Cyclone Biporjoy intensified into an extremely severe thunderstorm. Cyclone is expected from the Arabian Sea near Pakistan and India border areas on June 15 to 17, 2023, and continues to remain so. Cyclone Biparjoy is expected to make landfall near the border areas of Pakistan and India and the Gujarat on June 15. In Pakistan, it is expected to landfall on 4 to 8 p.m. Islamabad time. The following areas are expected to be affected by the cyclone. To know about the intensity, hazards and health prevention from coming cyclone and how to keep ourselves safe, watch this video complete. As you know, it's hot and humid, and that's the perfect weather for a tropical cyclone to form. Tropical Cyclone Biparjoy. The cyclone is currently a very severe cyclonic storm, VSCS, with maximum sustained winds of 140 to 150 km per hour gusting to 170 km per hour. Sea conditions are phenomenal around the system center with a maximum wave height of 30 feet. The cyclone's movement for the next 3 days. June 15th. The cyclone is expected to make landfall near the India-Pakistan border at around 4:08 p.m. Islamabad time. June 16th. The cyclone is expected to move northeast and weaken into a depression. June 17th. The cyclone is expected to dissipate over land. Areas in Pakistan that are expected to be affected by the cyclone: Karachi, Thatta, Badan, Sajawal, Tharparkar, Mirpur Khas, Umarko, Hyderabad, Tandu Allah Yar Khan, and Tandu Muhammad Khan. As a very severe cyclonic storm is now the strongest cyclone in the Arabian Sea after Tokte. The unfavorable condition is dry air in Pakistan and West Asia, which is a poison for tropical cyclones. As the cyclones move further, they will suck dry air from different regions. Additionally, the upper air divergence helped the cyclone intensify. Hazards of a tropical cyclone. Tropical cyclones can cause a lot of damage. They can bring heavy rain, which can cause flooding. They can also bring high winds, which can cause power outages and downed power lines. Flying debris from a tropical cyclone can also cause injuries and death. Cyclones can cause physical injuries, flood-related illnesses, vector-borne diseases, respiratory issues, mental health challenges, and disruptions in healthcare services. Cyclone area is expected to make landfall in Karachi, Pakistan, on June 15 to 20. The cyclone is expected to bring heavy rain, strong winds, and flooding to the city and surrounding areas. Residents of these areas are advised to take precautions, such as staying indoors, avoiding driving in heavy rain or high winds, being aware of the dangers of downed power lines and other hazards, listening to local radio or television stations for updates on the weather and safety instructions. Pakistan's National Disaster Management Authority, NDMA, has issued a high alert for cyclone area. The NDMA has advised residents of the affected areas to take the following precautions. Stay indoors and away from windows and doors during severe weather. If you must go outside, wear protective gear, such as a helmet, goggles, and gloves. Avoid driving in heavy rain or high winds. If you are caught in a flood, do not attempt to swim or drive through the water. Be aware of the dangers of downed power lines and other hazards. Listen to local radio or television stations for updates on the weather and safety instructions. The NDMA has also set up relief camps in the affected areas. Residents who are evacuated from their homes can stay at these relief camps. The government of Pakistan is providing financial assistance to those who have been affected by cyclone area. The government is also providing food, water, and shelter to those who have been displaced by the cyclone. So, how can you stay safe and healthy during a tropical cyclone? Here are a few tips. Stay indoors. If going out, must wear protective gear, and avoid driving during rain or wind. If stuck in a flood, do not swim or drive, and be aware of power lines and other hazards. Listen to the updates of the weather. In a cyclone-affected area, medical help may need in the following ways. Number 1. Provide basic first aid. Number 2. Offer emotional support. Number 3. Promote hygiene practices. Number 4. Distribute basic medical supplies. Number 5. Refer individuals to medical professionals or emergency services. Following these tips can help you stay safe and healthy during a tropical cyclone or hot and humid weather. So there you have it, a quick and easy guide to staying safe during a tropical cyclone. Now go out there and enjoy the weather. And don't forget to join our health conscious community by sharing, and subscribing to us, as we help you live life on your terms. Don't forget to hit the bell icon to ensure YouTube notifies you of the latest uploads. Thanks for watching.